The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare. Medicare has a number of preventative services that you are eligible for, but you might not be aware of just what those services are. We'll talk about that today in the show, and we'll talk about also, if you can't afford the premium, there are some programs out there that we can get you on that can help pay part of it or all the premium. So stay tuned.
Seems like the power bills just get higher and higher every year. I'm on a fixed income and it just doesn't keep up. I hate to do it, but sometimes I have to choose between my meds and staying warm.
No one should ever have to choose between staying well and staying warm. If you need help paying your heating bills, call us today to find out if you qualify. Help is available for both homeowners and renters.
The cold gets into your bones and you can't get it out.
Final call from like 566.
Hello, gentlemen. May I see your Montana Real IDs?
IDs? Why, I'm Captain Meriwether Lewis.
And I'm Captain William Clark.
Hang on, I see more than one William Clark.
It's the real me, I promise.
Discover more at mtrealid.gov. Available now.
Montana Real ID. It's the real me.
And me.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
If you give or receive care, you already know that it can cause stress on caregiver and receiver alike. The good news is, if you have limited resources, help is available. The Montana Lifespan Respite Program may be able to help you pay for care while you take a break. Even better news is how easy it is to apply. You can get an application online or have one sent to you. We'll get back to you within 5 working days. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Hi folks, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services, and I'm Brian Lamore. I'm back again. I'll be here occasionally. As I mentioned earlier, we were talking about Medicare and what's important about it, particularly the preventive services. So of course we have a wonderful person here. We got Kimmy Everman, host of Aging Horizons. Welcome to the other side of the table.
This side of the table, that's right.
Exactly. Well, you know a lot about Medicare, but like when I start a show, I'd like to start out with baseline.
Right.
What are the ABCs of Medicare?
Well, Brian, thanks first of all for asking what is a very important question in my mind. Let's go with the ABCs. First of all, you have traditional Medicare, and that's what probably most folks have. It's A and B, and then they get a D. And you also have a Medicare Advantage model, which is you get all of those parts together in one sort of a one-stop shop. So let's talk about what ABCD means.
Yes.
Okay, so A is your hospital coverage. So if you have some sort of illness that you have to have surgery for, whatever, that's what you use. B is for your outpatient services. So if you have to go to the doctor and you have a cold. Okay. Part C is the plan I just mentioned, the Medicare Advantage plans. That's still Medicare, and you are still a Medicare beneficiary if you have a Medicare Advantage. You're just getting your services slightly differently than others. And then D is for drugs, Part D for drugs and prescription drug coverage. Not, you know, I shouldn't say it's the newest anymore because it's been a lot of years.
Right.
And it's a wonderful, wonderful benefit. So glad we have it.
I'm glad you have it. Now, you have the ABCDs. How many of those are optional or that you can opt out of rather than, let's say, what's mandatory for 65 plus?
Well, you know, if you are taking original Medicare, you have your A and B. You can opt out of B, but you need to know that if you opt out, one, you're going to probably have a penalty if you want to come back in, and two, you're going to have to wait until an open enrollment to be able to get signed up. So a lot of people would not do that. The only folks that might do that might be a veteran who's being served through the Veterans Administration, but even then, it's not a great idea. Yeah. So I'm going to say right now, talk to a ship counselor before you drop that B. Okay, and then C is the Medicare Advantage. That's just a choice. D is another optional. But the same rules apply, Brian. Yeah. If you don't take it, you'll probably have a problem when you come in with a penalty, and you're going to have to wait until an open enrollment. So again, those two are, it's very important to consult with a ship counselor first before you decide where you're going to go, just so you can get the information you need. Yeah, you get good baseline, non-biased. They don't have anything on the shelf to sell you. That's right. And we have an 800 number we'll put up, and they're throughout the state of Montana. Call them up, because what we're talking about here, we kind of infer that it's complicated. Yes, it's complicated. Yeah, it is. And you know, once you have some assistance just getting through the system, it becomes more familiar, of course, but it's nice to have somebody who knows the information well. And it sounds like you don't buy Medicare now for your health issues, you buy it for your future health issues. Well, yes, Brian, and I got to say, that's a perfect segue into our preventive services piece, because I think a lot of folks may not know how many great preventive services there are. And you know, there's the thing that people need to go by is this: preventive services help conditions to not get worse, and to take them when they're most treatable. And it helps with diseases, because it's going to manage that disease more to avoid the complications that might come on. So these preventive things, lots of tests and things, are so important. They're so important. Well, let's talk about when you first become eligible for Medicare, and then I think once a year you're allowed to have a physician's physical performed. And that really ties into with what you just said and how you want to prevent and find out what's wrong. How important is that initial physical? So important, and it's called the Welcome to Medicare visit. So you're going to hear that when you come in. It's right away. You should have it done within the first 12 months. And then after that, each year, you're going to have an annual wellness visit. Now, let's start with that Welcome to Medicare visit, though. It isn't like your camp physical. Kind of. It's more of a history taking, so that physician has an idea of where you've been, what's happened in your health history, and what is needed down the road. And there may be something that comes up in that visit that is outside the parameters that the doctor may test you for or something. But if that doesn't happen, you won't have a charge. Yeah. So the only thing that would be extra would be something not related to the Welcome to Medicare visit. Then the annual wellness visit is a way to stay on top of that history and to look back at the year. Where have I changed? Is this going well? Is this not going well? Do I need different meds? Perfect time to stop in to your physician and have a talk for the for the year that's to come. I know we've talked to physicians before, and what's so important is that the physician has a baseline, knows what is normal for you, because then we're all not normal. That's right. What is normal for us individually, and that's so important to get that. Right, and you know, doctors are human beings. They need that information to be able to treat us correctly, and this is a way that Medicare has come up with that really covers the base as well. Well, it saves them money, and it saves you the issues of bad health. Exactly. And what are the steps you can start taking, because many times they find out there are certain things that you're not aware of that you're having a problem with. Now, we'll go down to the close on this segment. We'll talk more about preventative care and Medicare in general, so stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available. both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
I had a terrible fall in December, and I put a hole in my wall. I hit it with my head, and it really, really scared me. The Stepping On program gave me confidence. We had a physical therapist come. He gave me specific exercises to strengthen my legs. I think that a lot of people in Montana need to take this program. We all think that we get to a certain age, you hit 60, and we expect to fall. You don't have to.
My best friend could tell something wasn't right. I tried to hide it, but she knew. I just felt depressed. She wouldn't let it go. She was scared I might hurt myself. She told me I should talk to someone. I think she saved my life.
No one wears a sign that says, I need help with my energy bills. It's one of those things that's needed but unseen.
It's no fun to be cold in Montana, and heating bills can be cost prohibitive for a lot of people.
Because we care, we support Energy Share.
I like it that neighbors are helping neighbors.
1-888-779-7589.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare, particularly preventative benefits, maybe some programs that might be able to help you pay for Medicare if you need that. Rejoining us is Kimmy Everman. And Kimmy, let's talk about some of the preventative benefits that we get, particularly around that first physical.
Yeah, because I think the list is long, and people can, look this up online and such if they're wondering what they can do, but it's a great list, and I just want to go through a few. Yeah. You can have an abdominal aortic aneurysm ultrasound screening. There's alcohol counseling. There's that annual visit. There's breast cancer screening, cervical cancer screenings, colon cancer screenings, depression screenings, diabetes, HIV, heart disease, hepatitis C, lung cancer, all of those screenings, nutritional therapy, obesity counseling, osteoporosis. It goes on and on. And let me not miss the vaccinations, because we got a pneumonia shot, a flu shot, and a hepatitis B shot that might be very important to our audience. So those are most, but not all, of what is on that list. And if you don't know and you want to find out and you don't feel like going to your computer, you call a SHIP counselor.
Right. Now, are these only available for your initial sign-on to Medicare, or is this every year with your physical?
You can access these at any time, and really one of the greatest parts is that there's no cost. Yeah. There's no co-insurance or deductible or payment for these. And as I mentioned before, if something crops out of it that isn't related to that, the doc just finds it as you're talking or testing, you may get a charge for that. But these are not, they're going to be covered without charge. And the reason for that is that the Affordable Care Act has a piece that allows that to happen.
Allows for that.
Yeah.
So you can find out if there is anything that's wrong with you that you're not aware of, and then they can take the steps to start addressing it through the rest of the Medicare program.
Exactly.
And you pretty much discussed the cost, because this is all free pre-screening, but on the medical issues and their treatment, there could be a copay.
Right.
Okay.
And, I just think that you have the benefit as a Medicare beneficiary, use it.
Exactly.
Absolutely use it. And I just think that it's a great list. And like I said, call a SHIP counselor to find out more.
Yeah, but the 800 number, what's important is they don't have anything on the shelf to sell you.
That's right.
And
Objective
they have
folks.
free, unbiased information. In fact, in Helena, I'm becoming eligible for Medicare this year. They have a Welcome to Medicare session.
Oh, yes.
So I'm going to attend that. Well, I've learned a lot from you, but I want to get some more baseline because now it's going to be time to sign off on certain things. But now when we talk about cost, Kimmy, sometimes some people can't really cover the cost of co-pays or the cost of Medicare, but the good news is there can be some programs to help them.
Exactly, Brian. And you know, I want to start with, there's two main programs, three I guess, that are out there for Medicare beneficiaries. I want to start with the Medicare Savings Program. Now that is referred to by us government folks as MSP with our acronyms, and it covers a person's Medicare cost for the most part. There are 3 levels of it, so the folks that are in the most need get what's called QIMBY, or the qualified individual qualified Medicare beneficiary, and they are going to get their premiums paid, their deductibles paid, any kind of co-insurances or co-payments that relate to that. So great helping program. The next level is SLMB, or SLMB. Now, SLMB doesn't cover everything that I just mentioned. SLMB covers the premium each month, but still, that's $130 or so that beneficiary can keep for other kinds of expenses. And with SLMB, you don't have to be quite as needful as the person on QIMBY. And then we also have one more, which is QI, and that also covers just the premium each month. But again, you can make even a little more money on that and still be eligible. There are eligibility criteria in terms of your assets and that sort of thing. So the person that is looking for this assistance wants to call a SHIP counselor. They can help them get through that and figure out if they're eligible or not. And frankly, I say, try for it. You never know. So if you think you're eligible at all, try.
The answer is no if you don't ask.
Exactly. That's exactly right.
Now, can the individual apply for these programs through the Medicare SHIP counselor?
Yes, indeed. They can help them. And I guess one of the great things about that is that the other main program we have, low income subsidy, which helps pay for the Part D or the drug plan. You can sign up for both at the same time or apply at the same time, so you don't have to go back and forth and have a lot of different paperwork to fill out. That counselor will help you. That SHIP counselor will help you do it, help you get it submitted, and before you know it, you'll know whether you're eligible or not.
Eligible or not. And when do you become eligible for Medicare?
65 years old still. Thank goodness. I'm very happy for that. And what you want to do is you have a 7-month window to sign up. So you have 3 months before your birthday month, 3 months after. But since you're going to sign up soon, I'm telling you, do those first 3 months.
First 3 months.
Because then in your birthday month, you are ready to go.
Oh, okay, that's great, because I thought it was a month after, so I learned something here.
And if your birthday is on the 15th, you still start your Medicare on the 1st.
Oh,
so
that's great.
Very, very nice.
I better start studying.
Yes, indeed, and calling SHIP counselors.
SHIP counselors, great. Well, we're drawn to a close on this segment so quickly, but we have a lot more information about Medicare and how it can help you. Stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I had a pain in my neck and jaw. I was just short of breath. I was just so nauseous. I had a tremendous pressure in my chest. My heart felt like it was going to burst. I didn't know it, but I was having a heart attack. A heart attack. I could have died.
Know these warning signs and call 911 immediately. Symptoms of heart attack in women are often not recognized. New medications and treatments can prevent disability and save your life.
I'm Attorney General Tim Fox. Nowadays, all of you have to worry about cybersecurity. Something as simple as visiting pirate websites can put your computer at risk. Hackers use pirate websites to infect your computer and steal your ID and financial information, or even take over your computer camera without you knowing it. Don't let hackers into your house. Be careful with the websites you visit and warn your kids on how to stay safe online. To learn more, visit my website.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Hi folks, welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare, and particularly the benefits that you can get under it that you might not be aware of. Joining us again is Kimmy Everman. You're with Department of Public Health and Human Services. Now, we've talked about several helping programs to help pay for some premiums, but those pay just for particular parts of Medicare, not everything, right?
And so it's very important to clarify that. Thanks for asking. With the Medicare Savings Program, or MSP, that's going to do your Part B. That's going to cover your Part B premium, and depending on the level, it may cover deductible and co-payments, that
Which
sort of thing.
Which is outpatient with your physicians.
So exactly. B is outpatient, and one of the great things about it is that you don't have to worry about going to the doctor if you're ill about the cost. You get to go not stressed out about that. So that's pretty wonderful. Then the other major helping program we have is low income subsidy, or LIS. Some people may even know it as extra help. And that is specifically for Part D, which is, of course, our drug coverage. So, yes, they do correlate to very specific places. The other place is Big Sky RX, or the other program is Big Sky RX that helps pay for Part D as well. It's another one of those programs that it has a level up, so you can make slightly more, and they don't care about your assets. So people that have never been eligible for something in the past may be eligible for Big Sky RX. So that's another, and it's Montana homegrown. It's a Montana program, so we love it. But yeah, there is no reason to avoid your Medicare if it's a financial issue. Try, meet with a counselor and try to find out if you're eligible.
Well, I know you say meet with a counselor, and we have Medicare counselors throughout the state. We have an 800 number on the screen. Ask for a SHIP counselor.
That's right.
Because this does get a little complicated. You talk about these other programs that you might be eligible for, and you can figure it out on your own, but it's easier to ask someone who knows all about it.
Well, and not just easier, Brian, but actually kind of a smarter way to go if you're trying to get good information to help you make huge decisions about your life. Huge, not only physical, but financial decisions about your health care. Wouldn't you like to have an expert helping you through? Now, that expert is not going to say, Brian, pick ABC, but they're going to give you the different advantages, the different, things that you may or may not want in a plan. And that way you walk away well informed, knowing what you want and what you need.
But then these 4 helping programs, they know about that. By talking to you, they know that off the top, and they can help you to apply through them, and you make sure it's all correct.
Exactly. And one thing that we talked about off camera is that if you're in a Medicare Advantage plan, the helping programs can still work. You need to talk with a SHIP counselor because each case is individual and unique, but those programs can still come in and give you a hand financially if you pick that way of getting your Medicare.
Well, Kimmy, in going to the health club and talking to friends, they say, well, I'm glad I'm 65. Medicare pays for my health club dues. But that's not really Medicare. That's a different, it's the Advantage program. And what are some of the benefits or additional programs you might be able to get through an Advantage program if you so elect.
Right. Yeah, the Medicare Advantage plans are, if you've seen one, you've seen one. So that's another place where you have to be very careful with your information. And you're right, some of them do give memberships to gyms. They may have a little bit of dental coverage attached or vision coverage attached, especially those two things which Medicare at this point in time does not cover, regular Medicare.
Yeah.
So if you're looking for those extra little benefits, very important to take a look at several Medicare Advantage plans to compare and get with a SHIP counselor who can help you do that.
And find out about them. Well, now let's kind of recap again what we're talking about with Medicare, particularly the programs that can help an individual help pay for their premiums.
Right. Sure. The Medicare Part B, which is your outpatient, is connected to a program called the Medicare Savings Program. 3 levels. You can make a different amount of money, but there are eligibility criteria, so you want to talk to a SHIP counselor about that. And then also another major helping program is the low income subsidy, which is connected to the Part D or your drug plan. And it's going to cover, in some cases, premiums, deductibles, and copays will be coming down because you're on that helping program. And don't forget Big Sky RX, because it's a whole nother area that you can look into to get a little financial assistance.
And then we're talking about the Advantage plans, how they have additional benefits.
Right.
Some of these low-income plans will help pay for an Advantage plan.
Absolutely, yeah. They just need to, you just need to talk to the SHIP counselor who can give you some guidance as to how to find out exactly how much is covered. But don't go away thinking, oh, well, I won't be able to. Ask. As you said, the answer will be no if you don't ask.
And then again, let's recap the importance of that initial physical or your once-a-year physical and some of the things they cover and why that's so important.
Okay, welcome to Medicare physical, which you're going to get pretty soon, Brian, because you're turning 65, which is your baseline. They're going to ask you about your family history, your own health history, a lot of questions about what your health has looked like in the past. So know how to go forward. And then you're going to have access to that long list of preventive services we talked about. Then each year you're going to do the annual visit or the annual wellness, and that is a way for you to see where you're at on that baseline.
That's great. Well, Kimmy, thank you for explaining all this to us and for having all the SHIP counselors out there to help us. And, as we were mentioning, you get your Medicare health plans, not for your health now, but for the health in the future. It's pre-planning at its best. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.